Okay, so we're going to be talking about two postpartum drugs, both of which are immunizations. The first one is Rubella. Rubella is a childhood vaccination. However, if our moms are not immune to rubella, by the time they are discharged from the hospital postpartum, we do want them to have that immunization. It's just a sub-Q injection. It's a live attenuated virus, so that's something you're going to want to teach the mom about. The reason that we want to get them immune to this is because if they do become pregnant again, it can and then acquire rubella, a wild type, it can cause really bad birth defects on the fetus. Some of those, which you'll want to teach the mom about, are they're called congenital rubella syndrome, and it includes cataracts, glaucoma, hearing loss, which is one of the most common results of that, and some various cardiac defects as well. So we're going to want to give this sub-Q injection to mom before discharge. Some of the other teaching we're going to want to tell her is that we don't want her to get pregnant for at least 1 to 3 months. I guess we could say 3 months just to keep it on the safe side, because if she were to get pregnant while her body is fighting off or making antibodies against rubella, then it can possibly have the teratogenic effect on the fetus at that point, and we all know organogenesis is really in that early stage, so really want to avoid that. You're going to have to get informed consent, and that's, she's going to have some soreness at the injection site. It might have a fever, swollen lymph nodes, some joint pain, and that's about it. Another thing that your mom might ask about is the safety of getting this vaccine and breastfeeding, and it is safe with any natural passive immunity, so the baby can even be a little bit protected from rubella until it is time for baby to get vaccinated against rubella. And I just want to point out that passive immunity, so natural is through the breast milk. Passive is when you're giving the baby the antibodies to fight it off, so they're not actually making their own. So when they're weaned off that breast milk, they're not going to save those antibodies and have any memory cells. That's why they still need to get immunized themselves. Okay, and the second round of vaccines we're going to talk about are TDaP and DTaP. I'm not really sure if there is a significant difference on these. The only really difference I could find was that DTaP we give to babies, and TDaP we give starting, I think, in like 7th grade, and that's what you want to get as an adult. So for our postpartum moms, we'd be giving them TDaP. So DTaP is diphtheria, tetanus, and acellular pertussis, and TDaP is tetanus, diphtheria, and acellular pertussis. So it's the same 3 things. The DTaP, we give it to babies and infants at 2, 4, and 6 months. And the TDaP is one of the postpartum drugs that we can give mom. We're going to give it to moms who have either never had a TDaP or have not had their last tetanus diphtheria vaccine more than 2 years ago. And also, this is just like how I was saying with the natural passive immunity with rubella. This is going to give baby some of that immunity. If mom's breastfeeding, you'll get her natural antibodies through the breast milk, and that'll at least protect baby from diphtheria, tetanus, and pertussis until 2 months, when baby can get their own immunization and start making their own memory cells and their own antibodies. If another reason why we're going to want to give mom the TDaP is if she's not immune, is we don't want her acquiring any of those things and giving them to the baby, because as we know, pertussis or whooping cough can be really detrimental to an infant, and she can just pass on that natural passive immunity if she is breastfeeding, or we just want to protect like her not having her in the household, not acquiring it and giving it to baby that way. And this one is an IM. I'm sure you all remember getting your tetanus shot, usually deltoid, and it's kind of sore, like when you lift up your arm for a couple of days, and that'd be something that you want to tell mom about. And we're going to want to give the TDaP early in the postpartum period. All right, let me know if you have any questions, and I'll try to answer them before the test. Thank you.